How's it going, guys? Manny here again with Medical Mondays with Manny, and today we're going to learn how to do a lower arm splint. So the tools for this, we're going to be using a SAM splint, which is essentially moldable splint. You can use cardboard, you can use newspaper, you can use wood planks, whatever you have at your disposition to make an improvised splint. The way that we're going to secure the arm is with a roller gauze. The other option that you can use is medical tape. That also works great. And lastly, we will use a triangular bandage to form an improvised sling. Okay, first thing we want to do is we're going to check the patient's neurological deficits. So we're going to ask them if they can squeeze your fingers. Perfect. Next thing, you want to touch a finger of your choice and ask the patient which finger they're touching. And if they can feel that, that is perfect. That means that their sensation is still there. Next, what you want to do is you want to place the splint underneath the arm nice and carefully. Next up, what you're going to do is secure the splint to the arm. Once the splint has been secured, you want to check for CSMs once again. So circulation, check for a pulse. Sensation, ask the patient which finger you're touching, and finally ask them to wiggle their fingers a little bit. If they can do so, you are still good. Lastly, what you want to do is secure the splint to around the patient's neck, and this is just to ensure that we can restrict movement. So what you want to do with the triangular bandage is basically create a sling. So what we're going to do is we're going to tie it around the back of the neck. You can create a simple knot, doesn't have to be anything complicated. And lastly, you just make sure that the splint is holding onto their arm, and just like that. So the don'ts of applying tourniquets is to not attempt to manipulate a fracture or broken bone, as this can cause more damage and especially increase pain. Other than that, that is how you perform a lower arm splint. Thanks for watching. We'll see you next Monday.